Hello and welcome to our Doc Talk. This is NorthBay's way of reaching out to the community on important health issues. This is our every other week chat on COVID with Chief Medical Officer Seth Kaufman.
Thank you. Good morning, everybody. Thanks for joining us today. Dr. Seth Kaufman, I'm the Chief Medical Officer here at NorthBay Healthcare. I'm also a practicing emergency medicine physician. Thanks for joining. A reminder that Robin just mentioned, we are doing this now every other week. We'll be here at the same time, answering your questions, trying to give you as best we can the most updated information. So the next one after today would be Thursday, August 6th. So let's start with just the numbers and tell you where we are. And then we'll go right into your questions. As you probably know, there continues to be a rise in cases. Solano County is on the state watch list as an area with a higher impact and more cases. On average, we're seeing about 70 to 100 new cases a day. That's pretty striking for a county our size. We are currently at 50 hospitalizations. This is information is available to you on the Solano County Public Health website. That is also close to an all-time high for us. So we in the last several weeks have seen a rise in hospitalizations. The total count then of cases is about 3,000. It's just shy. It's around 3,000 cases testing positive in Solano County. And our positivity rate, our 7-day moving average, as of yesterday was 8.3%. Also very high. A reminder that at one point, one of the criteria for being off the state watch list or rules, this is months ago now, where the rules in terms of opening and reopening businesses was if you could maintain a positivity rate of under 5%. We are at 8.3%. Of course, that's a combination of more cases and also more testing and targeted testing. It's obviously a combination of factors that leads us to that 8.3%, but still remains very concerning. We've had 35 deaths. And with that, a few comments about where these cases are coming from. The majority remains, when we do the contact tracing, our county does investigations on all the positive cases. The biggest factors are close contact, so not wearing a mask, being within 6 feet, family environment, social gatherings, not being compliant with the current rules is the biggest factor. There are some workplace outbreaks. There are also some congregate living facility outbreaks. There are nursing homes, assisted living centers, prisons, as you know, if you read the news, San Quentin and others. Some of these cases are coming from outbreaks, and our county and others, including NorthBay, are doing our best to actively monitor these places, provide testing, PPE, and as much support as we can. And of course, the leadership and the administration of these facilities are doing absolutely the best they can to contain these outbreaks and keep their patients, their residents, and staff as safe as possible. A few CDC updates that you may not be aware of. They're all in the last few weeks, including one from this week. One is that the CDC is now advocating for safety eyewear in healthcare environments. There's studies showing that there are receptors in your eye, the conjunctiva, the mucosal surface of your eye, that has the receptor that the virus connects to. Does that mean you're getting it if your eyes are out? No, it requires a lot of factors, including a significant amount of virus getting in to cause it. But we know that the eyes are a risk, and we know with rising cases, there's more unknown. There are people out there who have it who don't know they have it. So there is some strong recommendations around eyewear, and that's what we've done here at NorthBay Healthcare. We have instituted a mandated eye protection plan in some environments, like the emergency department and urgent care, where the status of patients is often unknown. Like if we know they're negative, if we know that person doesn't have COVID, or we and with the best we can with our testing, then we're not necessarily mandating it. We're strongly recommending it in all environments and mandating it in areas where we know where we don't know the COVID status of a patient. The other more recent update is that the CDC has, based on data and some studies, have recommended that those who either suffered from COVID, have a severe illness from COVID, or are immunocompromised, so suppressed immune systems. Maybe a person has cancer and is under treatment, diabetes, on certain medications that suppress your immune system, that the isolation period from symptom onset get extended from 10 days to 20 days. So that's the longest we've seen. So that has not been formalized and adopted by Solano Public Health today. It is new update this week, and so more to come on that. But just so you understand, if you go to the CDC website, you can read all this. It is for public consumption. But in essence, the question is are people with severe illness or those who are immunocompromised, are they contagious farther out, longer than 10 days? That has to be balanced with a lot of studies showing that the contagious period drops fairly quickly after that first week, but can go up to 14 days, maybe 20 days. 10 days is out there also. So there's still a lot of studies out looking at this. And of course, the recommendation is we all just try to stay safe by wearing masks, keeping social distancing, physical distancing, 6 feet, more than 6 feet if you can, and good hand hygiene. So with that, let's go to our questions, Robin. What do we have?
Okay, so let's just start off by talking about the surge the county is seeing, and what can we do as individuals, as families, as groups to kind of break that down.
Yeah, so I'm gonna, that's a great question. So the question is we're seeing a surge. It does feel like some days, like, is there anything we can do? And of course there is. And the question is what can you do? And I'm essentially saying very similar things that our governor has said and others have said, that the current mandates, mask wearing, social distancing, hand hygiene, are actually very, very effective. They're very, very effective. And the majority of cases that are positive, not all, but the majority of cases are positive. When we trace back, we see that those rules were not followed. So really good distancing as much as you can. You don't have to measure 6 feet, just do the best you can. Remember that indoor spaces are the biggest risk. If you need to see somebody, if your mental health is at risk, like many of us are, and you just really need to have that interaction, not over Zoom, do it in the backyard, 6 feet plus apart from each other. Be really careful when you're going to the market, more than you were 6 weeks ago or 8 weeks ago. Remember, there's more cases, so it's an exponential increase. As more people get it, that they're going to spread it unknowingly to others. This also means that there's more people than you know that don't even know, that are asymptomatic, don't even know have symptoms, but may be spreading it. If we're all wearing masks and we're all keeping our distance as much as possible, we will slow the spread and contain it. And we've seen that in other countries. This is not a theory. Other countries, other places have been able to do this with those basic measures.
Great. So are there any new medications that we're hearing about, and what kind of results are we seeing from things like remdesivir and other drugs? And since it's in the news a lot, also, how hopeful should we be about a vaccine?
Those are great questions. So the question is tell us about the new medications out there. Gosh, can I have a vaccine yesterday, please? And move on with my life. So let me answer those questions. For starters, I'll say that overall, the only bright side to this pandemic so far is there's been an unbelievable amount of research in such a short amount of time, and we know so much more now than we did in the early part of the year when this all started, and we actually have better medications than we did back then and more data on it. So we have here at NorthBay, we are using remdesivir on a routine basis. There is a shortage of this medication. It's not always available, but we've been really aggressive in getting in having a stable allocation of medication, and we're using it in the patients that it's indicated for. And those are hospitalized patients that are very sick in general. Most recent medication that's now shown benefit is dexamethasone. That's a steroid. We suspected steroids were going to be helpful. There was some early data that showed it wasn't, and now there's some very good data showing that it is helpful in, again, hospitalized patients. As an emergency department physician, I would love to have something to offer those patients that are safe enough to go home, but we're not there yet. We're not there yet. Actually, some medications show harm, right? It's not just about, why don't we try something and see what happens. We have to wait for some data to come out. So the treatment options right now show benefit in those that are sick enough to require a hospital stay. And I hope nobody on this call requires that ever. So but if you do, there are really helpful treatment options, and we've seen benefit with those, particularly those two options. Of course, other maneuvers we do. There's something called proning, where we turn people on their stomach and on their side, essentially to open up their lungs, which has been shown to have a lot of benefit, and those and other measures too that really have shown that have people are getting better, and we're not seeing as much death as we would expect for the amount of people that have this disease. So that's really encouraging. The vaccine question is hard, and you probably, if you're watching other national leaders talk about, Dr. Fauci talk about it, it's hard. There's a lot of mixed data. Some weeks you're reading studies that show that the immunity is not, that the antibodies that are being produced are not lasting, like they just fall off after a few months. There's also some studies showing that the antibodies that are being created, are they really going to protect us? There's some data showing that there's no documented cases of reinfection. Like someone gets it, they get better, and then they get it again. We have not seen that. That's encouraging, right? That once you have it, you don't get it again. There's also a question of will there be mutations, and whatever vaccine we create won't be effective because we'll have to play with it and change it, and the mutation will cause a problem. With all of that, the most recent information in the last few weeks is that there's multiple trials out there that have passed into the kind of phase 3 stage. They've done kind of initial safety studies, and now they can recruit a larger group of people to test the vaccine. So I'm feeling encouraged with all that. My overall feeling is that we will have a vaccine. It doesn't mean that doesn't mean you get the vaccine and now you have no chance of getting it. It might just mitigate. It might decrease your risk for getting it. Maybe it shortens the course of it. It's hard to know. A little like flu, right? You don't get a flu shot and then you think there's no way I'm going to get the flu. It shows that you may not get the flu. You might get a lesser severity of the flu. It may not be as contagious. It's hard to know. So I don't have a great answer. I think we'll have an option in 2021. I would love it for it to be earlier than that, but we have to make sure it's safe first. But I'm encouraged that multiple vaccine trials are moving into the phase 3 stage of the research. That's the most encouraging part. And I think all these the other studies showing does the immunity fall off or some antibodies are effective and some are not are very early, and you shouldn't be too discouraged by that.
All right. Jada has joined our chat, and she has a question about how safe it is to visit the dentist, and maybe perhaps explain what you should be looking for if you're going to go to the dentist.
Sure. So a few comments. That's a tough question, so I like it. That's a tough question. Can you go to the dentist? And I would say that routine dental care is really important. On the flip side, that of course environment poses a risk. But with that, our dentists and dentists in general, they have requirements, and these are medical people. They have created a lot of safety measures. Everybody wearing masks and gloves and goggles and things like that to keep you safe. So I think the first thing to do is to call your dentist and say, what have you put in place? Does everybody have PPE that needs PPE? Will I have PPE when I come in there? And they're going to say yes to all of that. And tell you how they've created safety measures. If it's a truly elective situation, like you can hold off a little bit, talk to your dentist about it. Like, do do you have a cavity that needs to be filled? Because those just get worse, right? So I really do think it matters whether you need to have something done or you don't need to have something done. It is a discussion with the staff at the dentist. I think it's possible to go to the dentist and stay safe with all those safety measures in place, but that's if you need something that has to be done. Otherwise, maybe you can wait a little bit. Right now, case rates are so high, is it possible to delay things a little bit? And that's a discussion with your dentist.
Okay. And since we're on the topic of safety and facilities, let's talk a little bit about how safe North Bay's facilities are.
Sure. So, if you're looking at the Solano public health data or the state data or the data around the country, you know that if you're seeing more cases in the community, outside hospital walls, outside clinic walls, then of course we're seeing more cases in our hospital, more cases in our emergency department, and more cases in our clinics and urgent care, and that's all true. North Bay's been preparing for this since the beginning of the pandemic. As you may remember, we were one of the first to have a community transmission case before we even knew what we were dealing with, and so we've been tabletopping, practicing. We've been collecting our PPE, creating policies, surge policies for quite some time, since early in this pandemic, as one of the first centers that was exposed to it, to this virus. So everybody in our organization, of course, wears masks. That's a state mandate, and we were doing it, and everybody was doing it in healthcare before even the mandates came out. We cohort our patients in this units. If you come to North Bay Healthcare and you need to be admitted to the hospital, you will feel safe that you're not going to an area where there's also, if you don't have COVID, where there's COVID. You will be admitted to a safe environment where our staff are wearing appropriate PPE, and you're not going to be around patients who have COVID. We have those people in a safe area. Of course, if you have COVID, you will be in our COVID unit, where again we have adequate PPE, more than adequate, and we have great medications, great treatment. We have a very restrictive visitor policy. That's very hard for us. Telling people they can't come and visit their family members. That's of course to keep you safe, our staff safe, our patients safe. So we have very restrictive visitor policies that, except in certain situations, we can't allow visitors. We do have, though, video chat options so that you can speak to your loved ones who's admitted to the hospital. We have really good policies around labor and delivery. So obviously our mothers who are in labor can have their partner with them or a visitor with them. So there's a few exceptions. We have surge policies, and we test all admissions here at North Bay Healthcare. So anyone who's coming in the hospital gets tested for COVID. That's if you get admitted to the hospital. Hopefully you don't need to. And we do our best to separate our COVID concerned patients from others in all our environments, from our urgent care to our emergency department. And we do everything we can to make sure our staff is wearing all the appropriate PPE and keeping you safe.
Great. Jacqueline is on here, and she's asking, my daughter has mild asthma.
Yeah.
Would it be better to do social distance learning, and is it safe to take her to the dentist for checkups? And what about vaccinations?
Okay, so great question. So, of course, we're worried about our patients that have asthma. Could they have a worse response if they got a COVID? So let's break that down. The question is my daughter has asthma, and tell me how to keep her as safe as possible. If it's just a checkup at the dentist, I do think it's best to call your dentist and talk to them about it. Some have gone above and beyond. Many have gone above and beyond to keep you safe. But if it's just a checkup, I'm sure her teeth are great. Maybe wait a little bit right now. Wait to see if we can get over this surge and into a situation where rates are decreasing. So just less chance that you're going into an indoor area that has COVID. People with COVID who don't even know it, right? So I think right now we're in a particularly bad situation with a rise in COVID cases. If it's possible to wait a little bit for that checkup, I would. And that's only because we're in that surge situation, which we've climbed back at the direction order of the state. Solano County has gone back to essentially reopening at a 2A level, so that closed down a lot of businesses. That's just to keep everybody safe. So I think we should be following that, but also it's really important to go to the dentist if there's a problem. You asked about, I think, social distancing. Everybody should be social distancing. Yes, your daughter, as much social distancing as possible, and mask wearing all the time. There is data, and this comes from another question we had maybe a week or two ago. There's a question about, do I need to wear a mask if I'm more than 6 feet away? State mandate says if you're more than 6 feet away outdoors, you don't need to. It's not a mandate. I would tell you to wear it. It sets an example. We don't know 100% yet that there's not virus floating beyond 6 feet. I feel confident outside, but it's all about mitigation. It's like less chance. If you said, Dr. Kaufman, if I'm more than 6 feet away from somebody with COVID, am I gonna get it from them outside? And I can't tell you 100% no. I could tell you that it's it's lower chance. So I think when you're outdoors, as much as you can, you should be wearing a mask, even if you're more than 6 feet from people. And your daughter should just be wearing as comfortable as she can, a mask anywhere she goes. If she's hanging out with friends, it's in the backyard, social distanced, apart, with comfortable fabric masks on. That would be my advice. And you asked about a vaccine. Again, I said at the beginning, vaccinations. Thank you for the correction, Robin. Vaccinations. Oh no, vaccination schedules are really important. Really important. So yes, she should get vaccinated. Sorry, vaccinations, not the vaccine, the COVID vaccine. We're all about COVID around here. But I think the answer is yes. Vaccination schedules are really important. There are windows, so it doesn't have to be like. But there is a limit to the windows for many vaccinations. Talk to your pediatrician, but they're going to want you to get the vaccination schedule, so we stay safe from all the other illnesses that are out there.
Okay. How quickly does contact tracing take place, and what kind of message do you get if they find out that somebody who is in contact with you tested positive?
Okay, so how long does contact tracing take? That's managed. That's completed by our Solano County Public Health colleagues. They have actually hired a whole fleet of contact tracers to do this. So most of the time it is completed, my understanding, within a few days they're getting this done. I think it all depends on how many cases they get in a day, and with the surge, I believe that it's possible to have a backlog, but I know they're getting it done as quickly as possible and trying their best to get it done, completed within a few days. The way contact tracing works is that they'll call the person who has COVID and interview them. That may come from NorthBay, it might come from us. We assist in that process. So you might get a call from a NorthBay person saying, tell me where you work, what you've done. They'll explain to you the process. And then you'll understand exactly who the county will be talking to. More often than not, this doesn't require a lot of people to know that person is positive. It's about, do you work in a high-risk environment? Is your family safe? Do they need to be tested? That's usually the limit of what's needed. But you can imagine if you're working in an area where you're in close contact and the basic precautions were not followed, mask wearing, hand hygiene, adequate physical distancing, then it really needs a much larger discussion and with that in that environment, and you'll know what's going on in those situations.
Okay, so does COVID remain in the air? They're concerned about going into public places. Oh, sure.
Does COVID remain in the air? There's a lot of data on this, and the answer is that what the current no one knows 100%. Does COVID remain in the air? That's that's the question. Does COVID remain in the air? And the answer is I can't tell you 100% certainty with this, but there's more and more data, and the data is showing that this is mostly a droplet disease, as in it goes out and eventually over a short time lands on surfaces like the flu. But there's aerosol potential, and aerosol is in floating and staying up and small enough where it can kind of like be carried and stay out. And the factors that make it aerosolize is medical procedures where you're doing things in the mouth, or the person's maybe on a respirator or oxygen where it's pushing oxygen down, and that can like bring things up. That's one environment. So we know that in hospitals and healthcare, and we're very that's why you'll see in pictures that in healthcare environments where there's an aerosol generating procedure where we know it's going to be floating around, the staff and everybody are wearing maximum PPE. There are environments that have been shown to aerosolize outside of the healthcare environment, and that is there's the famous set of cases from the last few months where the choir group tested positive, and the thought there by the pattern of positivity of positive cases was that it was loud talking. It was loud talking or singing that did that. So we know coughing a little bit aerosolizes. We know that loud talking and other things like that aerosolize some. Does that mean you're going to get it if you're close to them or across the room or across the parking lot? I don't think people know that. Remember, it's not just the aerosol amounts. It's like, is it enough to get you sick? Is it enough to get you sick? From the pattern of positive cases across the world, it mostly looks like a droplet disease and not an aerosol disease. But there is little situations where we know it is floating here and there, and we don't know if that floating, in most cases, is enough to get somebody sick. With that, that's why the recommendation right now is if you're outdoors, wear a mask, right? If you're outdoors, wear a mask. If you're indoors, really wear a mask. That's where we know outdoors, there hasn't been a lot of cases contracted outdoors. But indoors, close environment, it's a risk. It's a risk. That's why we're seeing, sadly, some of the biggest factors in transmission is families, right? Even if you learn someone's positive in your family, they isolate. It's an indoor environment. You're living with them. It's really hard. It's really hard to completely avoid the transmission, and why we continue to advocate for outdoor activities if you're going to do something.
We have a couple of questions coming in on school. I'm going to kind of combine things here.
Sure.
Just your thoughts on opening up the schools and sending kids back in,
Yep.
But also if your child has asthma and it's hard for them to wear a mask for a certain amount of time, do you send her to school with a mask? Do you keep her home? What do you do? And you're a dad, so you're dealing with these issues.
So I have a 10-year-old. The question is school, and it is a hot topic right now. It is a hot topic. And what if my family member, my daughter, son, has asthma and wearing a mask is difficult? What do I do? Especially with school. So let's break that down a little bit. I do have a 10-year-old and 12-year-old, two girls, 10-year-old and 12-year-old. I have a going into 5th grade, I got to get this right, and going into 8th grade. And I'm sure all the parents out there, we could all commiserate on the challenges in the last few months. I would say the challenge is just anxiety and fear about our children getting COVID and if it's safe to go, and also all our concerns around whether they're getting an adequate education, right? It's a constant struggle. And so let's break that down. Number one, right now, cases are so high, I think it's really hard to advocate for an on-site education program. Combined with that, depending on the age group, it's really hard to ensure that they can do the distancing and the hand hygiene, the mask wearing at school. And that's irrelevant of whether you have a 6-year-old or a 14-year-old, right? In the 6-year-old situation, they just can't control themselves. In the 14-year-old situation, the social time is really important. Seeing your friends is really important. All the reasons we send kids back to school is going to be very challenging. There was a teacher friend as part of an email thread that really wrote some really wonderful things that I want to quote. I want to tell you about. That, she was saying how important it is that, we know that it's important for kids to be at school. American Academy of Pediatrics has weighed in on this, saying that there's real benefit that kids are at school with live interaction. But you have to ask yourself, what's that going to look like if we let kids go back to school tomorrow? They're going to need to be distance apart from each other. If they even get close to each other, the teacher's got to have to say something to them. So it's going to be like a lot of discipline is going to be needed Do they get to go to the bathroom? And what does that look like, right? The kids have to go to the bathroom. If their mask drops under their nose, the teacher's going to be calling them out. We're going to have a very nervous teacher up front, appropriately so, concerned about their own health and the health of the kids and their own family. Kids are going to be talking through masks. How's that all going to look? So there's no playgrounds are going to be there's not going to be any playground time. So the question we have to ask is is it worth the benefit? Are you going to get what you want out of it when these kids go to school? So the answer is I think starting out, especially in high impact counties like Solano, like some of the other LA County that has decided to start with distance learning. We start with distance learning, we watch the case rates go down, and we reevaluate. And in that time, it gives schools, districts, the state, you and I time to really make sure our kids can be as safe as possible. I do want my kids to go back to school. I just want them to go back to school when it's completely safe, and I want my kids to go back to school when they can actually have a school experience, right? And actually it's worthwhile. With that, by the way, then distance learning has to be robust, right? And our school districts know that. I think some have done better than others. It was a very fast, in spring, it went from you can be at school to you can't be at school over a 1 week period. So it was very hard for many school systems to kind of scramble to put something in place. I know many school systems now have spent the summer organizing their distance learning plans. Our kids need to be educated, and I think they're working on a more robust, standardized program in many systems for school education. Your child has asthma and has a hard time wearing masks. Is there a mask that will work for your child? That's what I would work on. Is her asthma treatment absolutely optimized? Just email your doctor. Do you need to go up on maybe some of the treatments, whether it's a steroid inhaler or other things that she's on to be preventative to allow her to wear a mask? Because the mask is the most important thing. Beyond that, as I just said, I think distance learning is the only option in high impact areas like Solano County and others. So I wouldn't send her to school today. I would wait and make sure that it's as safe as possible and really work on creating a situation where she can wear a mask for a prolonged period and that she's comfortable in it and won't have an asthma attack from it.
Okay, because you are a busy doctor and our time is limited, I'm going to start combining a couple questions.
Okay, and I'll try to be more brief if possible.
Okay, so if someone has COVID but is asymptomatic and not coughing, how do they transmit the virus? And then also, if you have a positive test and your quarantine is over, how long should you wait to retest?
Okay, those are two great questions. So first is, if you don't have symptoms and you're COVID positive, how are you passing it on? Breathing, touching your face, touching your nose that you probably don't even know you're doing. I don't know when I'm doing it. We don't know when we're always touching our face. If you're pre-symptomatic, there's a period of time when people test positive that they're extremely contagious. It's very early on when you contract the virus. And so you won't even know it if you never have symptoms. But there's a period of time where you're very contagious, where a little bit can go a long way. By the way, that's the whole purpose of the mask, is to control the source. So you're not breathing on people. Most of that breathing will be droplet, so it would fall on the surfaces. People touch it with their hands, they touch their face. You're talking close to somebody and without a mask on, and it's getting on their face, in their mouth, in their nose. So just breathing. Maybe you're clearing your throat. Anything that creates air in your mouth, nose, is going to be a risk. Eating food across the table is a risk if you're asymptomatic. So again, all those movements move saliva, mucus around and spit it out. And that's why you got to wear a mask all the time. The second part of that question, can you remind me what the second part of that question is?
It was how long to wait after a positive test and
quarantine. Yeah, we don't, people stay positive for quite a while, but they're not contagious for all that time. So actually there's no recommendation right now for repeat testing in terms of data, state, county mandates around this. So 10 days is the rule right now. 10 days from test positivity if you're asymptomatic or symptom onset, and you're viral load will be low enough that you won't be transmitting to others with any amount of concern. The exception is, as I said at the beginning, is this new CDC recommendation that people maybe have to be in isolation for 20 days before they can be kind of back out of isolation. That still needs to be formalized by our own county leaders.
Somebody is saying they've read that you can test positive if you've had a cold recently. Is that true?
No, not for COVID. Can you test positive if you just had a simple common cold? A lot of common colds are coronaviruses, amongst a million other viruses. So there are some antibody tests that you might test positive for when you didn't have COVID-19, you just had another coronavirus. The PCR test that we use for swabs and other tests are very good if you're positive. There's still probably a small, tiny percent, but most of the time a positive PCR test by nasal swab for COVID-19 is COVID-19, and then there's a small amount of false positives when you're positive, but it's not really COVID. But small enough that we have to trust those tests. Antibody tests, that's the blood test that tests for antibodies, is much more variable depending on which test you're having, and you could test positive if you had a regular cold from coronaviruses weeks or months ago.
And what are your thoughts about those that are exempted from wearing a mask on the governor's website?
It's hard. It's hard. It's really difficult. That list is there because we want to keep everybody safe. So if wearing a mask makes you sicker, then we're not helping you. In that situation, can you wear a shield? So a face shield has some value in terms of blocking things. Otherwise, social distancing is even more important. So if you're far enough away, you're not going to get it from that person. And if they're wearing a mask, you're not going to get it from that person. So face shields are effective, right? If there's splash and spray, like people are coughing on you, and you're wearing a full face shield, chances of it getting up and under and in is lower. Getting in your eyes is lower. So can you wear a face shield? There's the foam face shields where they're covering you. There's space there. I think those who can't wear a mask can usually wear a face shield, and then the person you're talking to, interacting with, better have a mask on.
Okay, great. So recent studies indicate that people with heart disease and diabetes are more likely to be hospitalized and die from COVID. Can you talk about why that is? I'm
not sure it's completely known. Those people generally are immunocompromised, so they have a weaker immune system. So that is one, especially in our diabetics, that is always a concern. There is also a factor in COVID. There is a phenomenon in COVID where it makes your blood clot more easily. So you become what we call hypercoagulable. And so actually one of the treatments for those with real severe illness that are hospitalized is they have to be on blood thinners. And so is that some of the factors in the higher rate of illness and death in those with some form of heart disease? Are they at risk for, if the type of heart disease is that your blood vessels are narrow because it has plaques, and then does obviously blood that clots more easily place you at risk. Remember, a heart attack is blockage of a blood vessel. So that is some of the theories and data that is out there. Being immunosuppressed, so a weaker immune system, and of course the increased clotting concerns with it can cause increased illness and death.
And for those who are tuned in, just so you know, we did a chat yesterday with diabetologist Jay Shubrook, and he talked about diabetes and the COVID connection.
Dr. Shubrook is amazing. He's a professor and an expert in diabetes, and that is so that's wonderful.
So I think we're about done. Oh wait, somebody's asking, are pregnant women at higher risk to catch COVID?
We haven't seen data on that. That's true in the flu, right? I haven't seen any updated data showing that pregnant women are at higher risk for this disease. So far we have not seen that. There also has been questions about whether you could pass it to your baby in utero, so when pregnant, and we have also not seen that at this stage, to my knowledge. So
our time is well past. And you are a busy doctor. We got to let you get back to work.
I'll see everybody, I hope, on Thursday, August 6th. We'll be here at 10 a.m. To answer more of your questions. Stay safe out there. Thank you so much for joining.